The 2013 Lasker DeBakey Clinical Medical Research Award for the development of the modern Coclear implant, a device that bestows hearing to individuals with profound deafness, honors Graeme Clark, Ingeborg Hochmair, and Blake Wilson.
When I first started in practice in the mid-'80s,
all right, let me take a peek in here.
we didn't have anything to offer children who were born deaf.
When Walter was born, he was born deaf in his left ear. About the age of 2, he started losing the hearing in his right ear, and he lost it rather quickly.
So they found out that I don't hear anything, and then they got to hospital, and they said the same, your child can't hear.
And the doctor would have to say, I'm sorry, there's nothing I can do.
In the late 1970s, most scientists and surgeons believed the restoration of meaningful hearing was impossible.
I was amazed. Most scientists of the world said it wouldn't work.
They thought that it would be very tough to replace anything that had to do with 25,000 nerve fibers of the auditory nerve.
How could anyone possibly have the hubris to think that that exquisite function could be replaced with a crude electrical stimulus?
Based on the spiral structure of the cochlea, where high-frequency sounds are received at one end and low-frequency at the other, Hochmair in Austria and Clark in Australia developed systems that could provide stimulation at multiple sites.
And it was clear to us that in order to reach the different nerve fibers along the cochlea, which are associated with different pitches, the further into the cochlea you go, the lower the pitch is. So we designed an electrode that was for 22 to 25 millimeters insertion into the cochlea. This device was first implanted on the 16th of December 1977.
When I made the key decision to develop place coding and multi-channel stimulation for a cochlear implant, I realized there were many basic questions that needed to be resolved. One, how do we localize the current in the cochlea so that it would be localized to nerve groups of fibers? Secondly, it meant putting electrodes inside the inner ear, and at that stage, surgically, the inner ear was seen as inviolable. You should not operate on the inner ear.
Years of testing were required to refine the devices developed to deliver signals to multiple areas in the cochlea. Often, the results were emotional for both the inventors and the patients.
Meine Mutter fährt mit der Straßenbahn.
This was absolutely exciting. Connie could immediately understand. Not badly, really, she understood quite well.
Are you interested in sports?
Not very much, only in swimming.
This was a very emotional moment for her as well as for us.
Graeme Clark recalls some of the emotional moments while testing the early implants.
You were standing right beside me, and you were pretty nervous. You were pretty anxious. You know?
I was.
Yeah, you were really standing there looking at me, and I'm, oh, okay. And I was, no. And then Richard kept going. And at that big second I heard a dong. I sort of went, oh, no, it was after 17 years profoundly deaf. And getting that sound back again, I was in heaven.
I was so moved. I did what I haven't been used to doing. I went into the next door lab and burst into tears of joy. I was absolutely overcome. All of the tension, all of the pressure, all of the hopes were round whether he could hear speech and understanding without the need for lip reading.
In 1991, Blake Wilson developed a new speech processing strategy which greatly enhanced the existing systems.
Once we were able to get out of the way and present to the brain all of the information that could be perceived, or most of the information that could be perceived through a cochlear implant, the brain saved us.
Take off my old one, put on yours. Extension to you.
It was beautiful.
She made her bed and left.
The increment in performance was huge and instantaneous. And the first patient that we tested with such a system said, "You've got it." Another subject that we worked with got nearly a perfect score on a very difficult test of speech reception, and he slapped the table and he said, "Hot damn, I want to take this one home with me." Then we knew we had something.
Today, over 300,000 people benefit from cochlear implants, including those with hearing loss from disease and trauma.
Hi, Dr. Tusi. I'm doing good.
I'm so glad you came here. It's so good to see you.
For children born with profound deafness, receiving bilateral implants during their first years
I've been good.
You gonna sit next to me?
Yeah?
Yeah?
provide a life of hearing never dreamed possible.
Do you have toy trains like Thomas?
I like playing with toy trains.
It's made a big difference in his life. He's able to go to mainstream school. He's in a regular classroom. What would you like to say?
I like to say, I love you.
Why do you love Dr. TC?
I love her because she fixed my ears.
It's a privilege. It's a joy. You know, it's the biggest joy of my professional career to be able to do a cochlear implant in a child who can't hear and know that he or she will grow up to have normal hearing. It's a profound joy. This is really a miracle.
But now that I can look back and see the results, I am blown away. The results are beyond my expectations, especially with the children. It's been just out of this world.
Spieß, Turm, yeah.
Just very motivating for the hopefully many, many years to come to see how much these people profit, children and adults, from the work that has been done, the hard work that has been done, the many years of work. It's so rewarding.
We had our hopes, but this has exceeded my wildest imagination, and I still have to pinch myself. And it's something that no one really could have imagined just 20 years ago.
Bilingual Max, the first child to receive bilateral cochlear implants, is spending the last weeks of vacation with his girlfriend before going off to university to study computer science.
Very good.
It's a kind of science fiction to have this technology. Now I have a usual life, I have a girlfriend, and I finish school and I will study. I don't know what I would be without it. It's awesome. It's awesome.